So I want to welcome everybody here today. We have Brittyn Coleman with us, and she is going to be, I've actually been really looking forward to this webinar for the last few weeks, especially after we just had the micronutrient workshop this past weekend. This webinar is actually going to complement that information, excuse me, so well. And it's not often that we get to dive into pediatric related topics. And so I'm super excited to have Brittyn with us today. If you don't follow us on Instagram and you haven't seen some of the Instagram lives we've done with her, or you're not familiar with Brittyn, she is a registered dietitian. She focuses in pediatrics. She's based in the San Francisco Bay Area. She majored in nutritional sciences, became board certified registered dietitian, obtained her master's of science in nutritional sciences, specializing in autism spectrum disorders. And you actually, your master's thesis was on connecting food aversions and nutrient intake in kids with autism spectrum. Is that correct?
That's right.
Great. Before starting her private practice, which you are fully private practice right now, I believe, Brittyn?
100%.
Okay. You had worked in interdisciplinary clinics and centers for kids with a wide variety of developmental disabilities. And you kind of started your journey because you have a younger brother who was diagnosed with autism or on the autism spectrum. And so that was, as I think many of us find, there's usually either ourselves or a loved one in our life that goes through something that inspires us on our own health journey. So I just want to welcome you, Brittyn. Thank you so much for your time today, for spending your lunch hour with us. And for anybody who has questions, we will have time at the end for Q&A. If you want to go ahead and type them into the Q&A or the chat, that's fine. We'll hold the questions till the end. But without any further ado, Brittyn, welcome. I'm going to go ahead and turn it over to you, and you can dive right in.
Awesome. Thank you so much, Sarah. I'm so excited. This is an area that I absolutely love. And so to be able to give a webinar about it is just so much fun for me. So thank you for that introduction. And we'll dive right in. She basically already introduced me. I'm a registered dietitian located in San Francisco. I am completely private practice. I've been in private practice for 4 or 5 years now and absolutely love it. And like she said beforehand, I was working in other clinics for kids with developmental disabilities. I am the sibling of an individual with autism, and I'll actually talk a little bit about him next. But you can find me on Instagram at Autism Dietitian if you're interested in learning more about nutrition for autism. And then I also have a membership called the Autism Nutrition Library to help teach and share research about nutrition for autism, sharing those evidence-based approaches. It's intended for parents to help them become less overwhelmed on their journey, but we do have many, many providers who are in the Autism Nutrition Library as well. So I'll share more about that at the very end, but it's nice to meet you all, and thank you so much for having me. So this is my brother Barrett, and I always like to start with him because he is my why. He's the reason why I dived into nutrition for autism. And I truly believe that being his sister and understanding more about autism from a personal perspective has made me be able to serve my clients in a comprehensive way where I don't understand where they're coming from as a parent, but I understand it as a family member and how much autism really impacts nutrition and coming at it from a different perspective. So he was diagnosed when he was 2, and now he's 25 and doing very well. And we are so proud of him, and it truly has made such an impact on my journey and serving my clients even better. So I love to talk about him. I won't take up too much time of this webinar, but I have tons of info on him on my Instagram if you're interested in learning about his story. So as we get started, I wanted to just cover the basics on autism because I don't know who's joining, how familiar you are with autism, if you currently work with kids with autism, or if you're just looking to learn more. So I figured that I would just cover the basics. So autism is a broad range of conditions, and it's really characterized by challenges in social skills, repetitive behavior, and issues with verbal and nonverbal communication. It's estimated that it affects 1 in 54 children, but some more recent studies show that it may even be 1 in 48. So we see that this number each year is it's affecting more and more children. Back in the early 2000s, this was even 1 in 250 or 1 in 500. So we see that it's definitely something that we really need to pay attention to, with it affecting so many children. Now, the reason we think that those numbers could be changing is a difference in diagnostic criteria, but it could also be that more and more children are developing autism. And so that's something that we definitely need to pay attention to, because we don't necessarily know what causes it. So we see that boys are 4 to 5 times more affected than girls. And generally it's diagnosed around 2 to 4 years of age. So in 2013, what happened was they had a lot of different diagnoses, and autistic disorder was one of those. But in 2013, what they did is group all of these diagnoses under one umbrella and call it autism spectrum disorder. So this grouped in Asperger's syndrome and pervasive developmental disorder and autistic disorder under this one umbrella. And so it really describes a wide variety of people. And so there's no one size fits all approach here. Even if it was just within that autistic disorder, that previous diagnosis, there's such a wide variety of kids and adults, of course, under that umbrella. And so it's really important that we individualize our approach. So for full diagnostic criteria, definitely check out the DSM-5, where it talks about autism spectrum disorder and all of the other diagnoses that were included under that in 2013. There are a lot of symptoms that commonly come along, but a few are listed here. Some sensory sensitivities, and a lot of times we'll see sensory processing disorder, which isn't a diagnosis recognized by the DSM-5, but it's something that's commonly recognized among many professionals. And this is where kids will interpret a sensory experience in a different way or an abnormal way. So something like a loud noise may be manageable for a child without autism, but it could cause an extreme meltdown and overwhelm in a child who does have sensory processing disorder or autism spectrum disorder as well. We also see that gastrointestinal disorders, inattention, seizures, sleep disorders, delay in verbal communication, poor eye contact. I mean, there's so many things that come in autism, but they can be at varying degrees. And some kids with autism do have all of these symptoms and some don't. And so it's, again, very important to get a diagnosis, because on to my next slide, there are no medical tests like a blood or DNA test that can diagnose autism. Now, there are some genetic mutations that we see may cause an increased risk of autism, like Fragile X, or might be associated with autism, but there's no diagnostic test. So it's important that they get evaluated by a developmental pediatrician or a psychologist. And in fact, my mom is actually a developmental psychologist who was able to recognize my brother's autism very early on and get him the early intervention that he needs. So what's difficult is that a lot of these diagnoses, or a lot of these evaluations, they're waitlisted for a year or so. And so by the time they're 3 or 4, sometimes even older, getting diagnosed, we've missed a lot of that early intervention. And so if you have a client or you know somebody who may be at risk for autism, getting diagnosed or getting on that wait list is always great. And some people even start early intervention sooner. And when I say early intervention, I mean speech, occupational therapy, nutrition. Nutrition can be started at any age, right? It can benefit anyone, even if they're not on the autism spectrum. But here's just a little bit more about diagnostic testing. However, we'll keep moving along since that's not necessarily nutrition related, but it is helpful. So we don't know what causes autism, though many practitioners, myself included, believe it's a combination of genetic and environmental factors. And we don't know necessarily what triggers autism or what causes the development of autism. That's something where we need more research, we need more funding, we need more time to develop to figure out what is the cause of autism. There are some risk factors that we know about. Genetics, like I said, like Fragile X, we see that 2 to 3% of children with autism do have Fragile X syndrome. It's the leading genetic cause for autism. Now, 2 to 3% might not sound like a lot, but that makes up millions of people. Then we have gender. Maybe more males are diagnosed than females, or maybe the diagnostic criteria is fit for males and not for females. So we still have questions there. Immune dysfunction and prenatal and perinatal factors like toxin and drug exposure, nutrient deficiencies during gestation, and autoimmune disease as well. There are some special nutrition considerations for autism that we really have to take into account whenever we're working with kids with autism. So the worldwide symbol for autism is the puzzle piece. And in nutrition, I actually think this could be a very helpful symbol for us to think about, because puzzles have many different shapes and sizes. Some have 1,000 pieces, some have 10 pieces. They have different shapes. There are all these things that we have to put together to make the puzzle. And coming from a nutrition standpoint, there may be multiple points that we have to focus on and bring in to help optimize our approach for kids with autism. So it's usually not just one dietary approach. There's no one size fits all. It's finding this individualized approach that works for the individual. So starting with some of the special nutrition considerations that we really need to consider, number one is gastrointestinal issues. So kids with autism are nearly 8 times more likely to have at least one GI symptom, the most common symptom being constipation. We see other things like stomach aches, nausea, bloating, diarrhea, but it's very common for kids with autism to have these GI issues. This comes down, I could have a whole nother webinar in GI issues for autism. In fact, I have presented on this in the past, but yeast overgrowth and dysbiosis, which is the imbalance of gut bacteria. There's a lot to unpack in the GI system for kids with autism. There's a lot of really interesting research studies. We also see, kind of lumped into this, poor digestion. We can see that kids with autism often have lower or decreased digestive enzyme activities. And so this means that they can't digest the food, which if they can't digest the food well, that can also come out as gastrointestinal issues. So these are really related here, but it's important that we look at both, because digestion can impact the way we break down the food, but GI issues like yeast could impact the way that we absorb the food. Then we see immune dysfunction. Now, this study that I linked here does have to do with GI symptoms in kids with autism and having an imbalanced immune response, but we can see other studies that are with kids without GI symptoms or GI issues and still having this abnormal immune response. We can see this come out in reactions to different foods or higher reactivity or higher food sensitivities. And so it's really important that we also take into account the immune system. And we see oxidative stress, meaning kids with autism are considered more vulnerable to oxidative stress. We often see that they have lower levels of certain antioxidants, especially glutathione, and which is something that's tested in Vibrant's micronutrient panel. We see methylation, and I'll really dive into methylation because there is a lot to talk about when it comes to methylation, and I'll talk about that later on in this presentation. Of course, you know, based on the topic of this webinar, but we do see that there's some connection with kids with autism and methylation and the MTHFR genes. So we'll really dive into that. And then lastly, picky eating is something that I think most people are familiar with when it comes to autism, that a lot of kids with autism are picky eaters. In fact, we see in the research that the odds of a child having a feeding problem with autism are 5 times greater. So this is something that's really important for us to address. It often comes down to that sensory processing piece, like I said, that can impact the way that somebody interprets their senses. So we often think eating is one of the most sensory rich experiences that we have as humans. We're smelling the food, we taste it, we feel it in our mouth, we feel the temperature. And when all these things are happening at once, kids who have a sensory interpretation issue or sensory processing issue might have a really hard time with trying new foods or trying foods that change every time they eat them or that aren't crunchy. And so oftentimes we end up missing out on a lot of nutrients because there's severe picky eating in many kids with autism, not all, but many. So you might be wondering, okay, so all these 6 things that I just discussed, is there a common thread? Well, if you guessed nutrient status, then you are on the right track. And that's what we're here to talk about today. Like I said, digestive issues, not being able to break down the nutrients, not being able to absorb the nutrients, not being able to methylate and activate the nutrients, or even consuming them in the first place, really puts kids with autism at a higher risk to have micronutrient issues and nutrient deficiencies. So here's just a nice visualization of what I just said: the restricted diet, poor digestion, malabsorption, methylation, and then I added in a little tab on medications. I won't talk a lot about that, but Vibrant does have a nice resource about medication interactions and diet and things to pay attention to, and I'll reference that later. So to start out with restricted diet, kids with autism have significantly higher levels of food refusal, significantly lower levels of food repertoire, and less variety of fruits and vegetables. So we know that that causes a decrease in the nutrients that they are going to eat. If they're eating less foods, they're eating a smaller variety. And what I often find is a lot of kids with autism like to stick to what we call the blonde foods, which are our chips, our French fries, our chicken nuggets, things that are that blonde color. Some people call this beige, and or the beige foods. They often don't have a wide variety of nutrients in them anyway, so we're missing out on a lot of those. Now, the reason why we might have a restricted diet, one is involuntary, so picky eating. Number 2 might be a voluntary restricted diet, meaning that we have a kid on a dairy-free diet, which may also be low in calcium. Now, because we know a lot of kids with autism do have more food sensitivities, they're also more often to be on some sort of special diet, like a dairy-free diet or a gluten-free diet, the GAPS diet, which is really restrictive, and we can end up missing out nutrients, especially if they're used long-term. So are we using a diet long-term, or are we using it short-term? If we're using it long-term, what are some of the implications that we need to think about? What nutrients could they be missing out on long-term that maybe we need to work on building in or the foods that do have that nutrient that are allowed on their diet, or supplementing? And then a fail-safe for a very, very restricted diet, somebody who has a severe picky eater, I like to have a high quality multivitamin in there. And I'll tell you about a few of the things that I look for, but I always want to start with diet first, and then supplements are great to add in. With picky eaters, oftentimes we have to start with some sort of a multivitamin to cover our bases. And then in the meantime, we can also be working with a feeding therapist, who's oftentimes an occupational therapist or a speech pathologist, who can help expand the amount of food. So those 2 things really go hand in hand. Short-term, multivitamin; long-term, we're expanding the foods that they're eating, because we all know that doesn't happen overnight. Next, we have poor digestion. Now, the first thing I want to talk about is low stomach acid. And low stomach acid can be caused by bacterial infections like H. pylori, for example, or yeast overgrowth. These can be tested with the gut zoomer that Vibrant has. You can also see low stomach acid coming up with aging, stress, and medications, or certain nutrient deficiencies. So when we have certain nutrient deficiencies that are causing low stomach acid, like zinc, this is almost a never-ending cycle, right? Where we have low zinc, then we have low stomach acid that we can't break down the nutrients, then we're not absorbing it. So there's this whole cascade that we have to think about, and addressing any underlying nutrient deficiencies is a really good first start. Then, like I said before, we have a lack of digestive enzymes. There's one study that shows that kids with autism have significantly decreased sucrase, isomaltase, maltase, and lactase. And that can cause a major issue with GI symptoms like bloating and diarrhea, or even constipation, and then not being able to break down the nutrients. And this contributes to malabsorption. So malabsorption, I love this visual that Vibrant has that shows all of the different areas that you absorb nutrients. So in the small intestine, which makes up the duodenum, jejunum, and the ileum, this is where you absorb a lot of your nutrients, especially in the duodenum and jejunum. So this is where we really need to focus on making sure that we have good gut health, so that when we do eat those nutrients, we can actually absorb them well and be able to build up that nutrient status. The nutrients are absorbed or synthesized, like vitamin K, for example. It's made in the large intestine by the bacteria. And we need to make sure that everything is working in the gut and that they have good gut health in order to break down, absorb, and then even make some of those nutrients too. So there are some risk factors for malabsorption: poor digestion, like I said, candida overgrowth, which is yeast overgrowth, dysbiosis, which is imbalance of gut bacteria, inflammation like leaky gut, prolonged use of antibiotics, food reactions, and celiac disease can all cause issues with malabsorption. Now, we don't see a strong connection between celiac disease and children with autism, though we do see there may potentially be an increased risk for mothers who have celiac disease. So that's something to definitely look into, but we definitely need more research there. Next thing is methylation. So we're just working our way down that list. So methylation is a really complex cycle, and I love to talk about it, but I want to prevent going too far deep down the methylation rabbit hole. But what's important to know is that nutrients, there are many different nutrients needed for methylation. A lot of people focus on folate and B12, but there are many other nutrients that are really needed, like vitamin B6, vitamin B2 and B3, magnesium, zinc. Betaine is needed, which is TMG or DMG. There's so many things that are really needed for this methylation cycle to work well. So if you're looking at this and you're like, what the heck is methylation? I have a few slides for you. So methylation essentially is this process of adding what's called a methyl group, which is a carbon and 3 hydrogens from one substance to another. Now, for nutrition terms, this is something that's really important for us to acknowledge because it really helps activate folate and B12 so that our bodies can be able to absorb them into our cells and utilize them. But methylation is not just with folate and B12. It does have a significant impact on many other biochemical reactions in the body, like DNA production and neurotransmitters and detoxification. So this is something that can start with nutrition. It's definitely something that we need to hone in on if we know that there's a methylation issue, so that we can focus on diet and supplements to make sure that we help the methylation cycle be as efficient as possible. Now, one way you can see that the methylation cycle may be off is by testing micronutrients. But another thing to look at is the MTHFR gene mutation. So that stands for methylene tetrahydrofolate reductase. And these are genetic mutations that are called C677T and A1298C. Vibrant does run both of these, and I do this on all of the clients that I work with. They can do a mouth swab or a blood panel. And I believe they can actually do a finger prick for MTHFR2. So this really helps us get a good idea if we have a genetic mutation on either one of the MTHFR genes that could affect the way that somebody actually breaks down and methylates. Now, just because somebody has the MTHFR gene mutation, that doesn't mean that you have to all of a sudden start megadosing with folate or methylfolate, which we'll get into in a second. It just means that it's something that we need to remove, like folic acid from the diet. We need to make some other lifestyle changes in order to optimize this gene. So there are things that you can do with nutrition to prevent health issues in the future. We know that, especially with that C677T gene, that you can have higher risk of heart disease later in life or high levels of homocysteine. And by looking at this, knowing if they have the MTHFR gene mutation and using the appropriate nutrition early in life, we can prevent the rising of homocysteine levels later in life. The goal of this MTHFR gene mutation for nutrition purposes here, to produce L-methylfolate so that it can be used by the body. This is the form that our bodies use, the active form of folate, and put into this process called methylation. We see, as you can see in this image to the right, the MTHFR genes are more common in autism than controls. Here's a study that I linked. There are quite a few studies. This one is a meta-analysis done from 2019 that looks at both of the MTHFR gene mutations. And we can see that there may be an associated increased risk of autism in overall and by ethnicity. And but we can see that there are some differences in some of the studies that look at C677T, that is more common in autism, and 1298 is not significant. So there's a lot of mixed information, but what most of the research studies tell us is that there is an increased risk of the 677T, or at least it affects individuals with autism more than the 1298. So I'm happy to provide these resources for you as well, but there's a lot to unpack here with MTHFR and autism. So I've talked a lot about folate activation, what that means. So just to have a visual for what this looks like. So folate is a B vitamin, it's vitamin B9, and it comes in many different foods like leafy greens. And we can also take it from supplements. And a lot of supplements have what's called folic acid. And folic acid is a cheap synthetic form of folate that you can take. Now, folic acid is inactive. Your body has to turn it into this active form of folate so that your body can actually use it. So it goes through many steps. Goes from folic acid to dihydrofolate to tetrahydrofolate to 5,10-methylene tetrahydrofolate, and eventually into this L-methylfolate. So this is the active form that participates in that methylation cycle. This is what we want. So here's a few other sources you can see. This is where vitamins, many vitamins like the cheaper ones, fortified grains come in at folic acid. Food sources can come in at a few different places. You can see it in L-methylfolate and the less methylated form. But what we really want to focus on is getting these higher methylated options. If somebody has the MTHFR gene mutation, then we want to just supplement with that L-methylfolate. Just go straight to the source so that we can just go ahead and skip that step that's hard for them to do, methylating and getting it into the cell. We can go ahead and just supplement with L-methylfolate. Some people may be a little more sensitive. So if you notice that somebody has a hard time with methylation and you drop in a bunch of methylfolate and they have some sort of behavioral reaction, or they're not feeling well, or whatever it may be, we can pull back. And some people do a little bit better with like folinic acid, for example. You can see that right here. So it definitely depends on the individual, but if we are looking at a blanket like multivitamin, we want to make sure that it has this L-methylfolate for kids with autism because they are at higher risk to have methylation issues. I talk a lot about folate here, but this is very similar for B12. B12 has a very inactive form too called cyanocobalamin. And I'll link that later, but we want it to be in the methylcobalamin form or something higher, like there's even adenosylcobalamin and hydroxycobalamin, but we just don't want that cyanocobalamin because kids with autism, if they do have that MTHFR mutation, cannot break it down and methylate it very well. And that can mess up the methylation cycle. So if I were to show you a photo of what the entire methylation cycle looks like, this is what you would get. And we are not going to dive into that today. It is so complex. But when we dig just a little deeper and we look at this basic methylation cycle here, we can start to break it down and kind of understand what it's telling us. So I just want to point out a few things. You don't need to understand this entire methylation cycle. We can see our little methyl group come in here that we recognize. The first thing I want to point out, we see this dietary folate, this folate that's coming in from our food sources that puts itself into this methylation cycle. Then we have our MTHFR gene. We see that it makes that 5-methylfolate. And we also see there's some cofactors here that are important, like B6 and B12, B2. These are things that I mentioned beforehand that are important for this methylation cycle. So we need to make sure that children are getting enough of these B vitamins to support the methylation cycle. Folate and B12 are at the top of my list, but B6 and B2 and magnesium, like I said before, all of those nutrients are very important to make sure that this cycle is operating appropriately. Now, there's some factors that may impact methylation. Number one, we know genetic mutation like the MTHFR gene. Then nutrient deficiencies. Of course, if we are low in certain nutrients, we can't operate that cycle very well. And picky diet, poor nutrient intake, malabsorption, poor digestion, all of those things that we've talked about can all affect nutrient deficiencies and nutrient status. The other thing is toxin buildup. And this is one of my favorite topics. Again, I could have a full webinar all about toxin buildup and toxic load in kids with autism, but methylation, if you're not methylating well, you may also not be detoxing very well. So removing toxins from their environment, whether that means air filtration or choosing better personal care products or cleaning products, removing fragrances from the home, those can also be good things to help free up that toxin buildup in the body. What I really like about Vibrant is that they have a urinary environmental toxins panel, and I use that in many of my clients too. So I'm doing many of these tests all at once just to get a good idea of what's going on and how can we look at this child as an individual and address their individualized needs. And then the other two things that can affect methylation are inflammation and folate receptor malfunction. We actually see that this can happen in autism too, where they have antibodies on their folate receptor genes, and it can impact them actually being able to absorb folate or utilize it in the brain too. So there's a lot to unpack about methylation and folate, and it's such an important nutrient for kids with autism, and having these B vitamins that are abnormal can really be a risk factor to throw off the cycle. And we often find that kids aren't eating lots of these B vitamins, or we don't have good stores of the B vitamins based on all of the other risk factors that we've discussed already. So here's the one little plug I'll make about medications. There are certain medications can induce nutrient depletions. There's a really great handout. If you're a provider with Vibrant Wellness, they have a really great handout that you can download under the micronutrient section in education that talks through medication interactions for micronutrients. So I won't spend too much time here. The one thing that I will say is that many kids with autism have been on multiple rounds of antibiotics. And so we know, usually because of recurring ear infections or strep infections, by the way, but we know that antibiotics can wipe out the beneficial bacteria, which create some B vitamins and create vitamin K, can create some issues in the gut and maybe cause some malabsorption issues. So that's definitely one thing that I notice is that many of the kids that I work with have been on many rounds of antibiotics. The ones that I've listed below here are common medications that we see in kids with autism. There's a huge list that you'll find on that handout from Vibrant, but these are the ones that I find that are the most impacting kids with autism the most. The next one I'll talk about is laxatives. I see a lot of kids who are chronically constipated with autism have to be on laxatives. I just had a new client come in on my caseload who has been on Miralax for 10 years, and nobody thought to take them off or address any sort of issue going on. And that's not on the parent, that's on the provider there. That's, in my opinion, unacceptable. And we haven't tested them yet, but I bet you I can guess that they're going to be low in a lot of those fat soluble nutrients. And because they have these watery stools every day from being on a laxative for 10 years. So I'm excited to work with them and kind of get to the root issue as to why they're having constipation and some reliance on laxatives. So important notes here, there are many different reasons for nutrient deficiencies. So it's really important for us to consider each factor. And these factors can even be interconnected, and it could be a cascade. So for example, a child who is a really picky eater starts to be lose out on a lot of nutrients. They have poor nutrient and low fiber intake. Then that can impact the bacteria in their gut, which causes gut issues and malabsorption, which causes nutrient deficiencies. Nutrient deficiencies cause increased behavior and autism symptoms, which lead to medication and nutrient depletion, lack of appetite, and picky eating more picky eating. It can just be this whole cascade. And so that's where it really comes in. It comes down to being able to figure out what is going on, what Are they having GI issues? Is the picky eating kicking off this cascade? How can we start at the root and work our way up from the root? So picky eating is definitely something that should be addressed. And like I said, often recommend finding a feeding therapist in addition to working with a dietitian who's familiar with picky eating and autism. My favorite type of feeding therapy is called SOS feeding therapy. And they have a really great directory on their website where you can look up your zip code and find somebody nearby, which can be a great referral source if you're a provider or if you're a parent looking for a feeding therapist. It can be a great way to find somebody nearby. For nutrient deficiencies, we can't really have a nutrient deficiency in our micronutrients, but we can definitely underconsume them. So underconsumption of protein and fats and carbohydrates and especially fiber can cause major long-term health effects. So we want to make sure that we are consuming foods from each group of macronutrients. For micronutrients, we also want to make sure that kids might be getting protein and fats, but if they're not getting these nutrients that are very vital for brain function and organ function and focus and immune function, we really need to make sure that they're getting them and not running on E, because that's when we can start to see the exacerbation of autism symptoms. And it's sometimes can be hard for us to discriminate between, is this a symptom of autism or is this a symptom of a micronutrient deficiency? So that's where it can be really helpful for us to test and figure out, okay, what specific nutrient deficiency do we need to be working on? And do we need to address that with diet or supplements or both? So here's what the research has to say about different deficiencies in autism. We see that they often consume below the recommended amounts for calories, protein, carbohydrates, fat, fiber, vitamin A, vitamin D, vitamin C, calcium, iron. I mean, there are so many other studies that talk through this. I just listed 4 here, but there are so many. You can basically find a research study that shows kids with autism do not consume enough of nearly every single vitamin or mineral. So this is definitely something that is a big issue across many kids with autism. So getting in to see a feeding therapist, making sure we're filling in the gaps, testing to see what's going on, if we're missing any nutrients, if we can replete them, then we can definitely see an improvement in behavior and symptoms and just help the kids feel better. That is my number one goal, is to help kids feel their best so that they can be their best. A lot of times kids with autism are nonverbal and they can't explain that they're feeling all this fatigue or that they constantly have a headache. So they're acting out by head banging, or their tummy feels not so great. And so they're having a hard time sleeping. There's so many things that go on in autism, and nutrient deficiencies are another one of those that we see that happens very often. Now, the most common nutrient deficiencies I see in my practice are omega fatty acids, vitamin D, and then what's special about Vibrant and the testing, they're able to look at serum levels and intracellular levels of all of the nutrients. So I often see that B12 and folate are depleted intracellularly, but they're through the roof when we look at the serum. And so if we were only looking at the serum, we wouldn't get that full picture. And in fact, I've worked with clients who will go to their PCP and they'll get a serum level of B12 or folate, and it's through the roof. And their doctor says, stop taking your B12 or folate. And they're like, I'm not taking B12 or folate. We're not supplementing at all. What that indicates is that there's a methylation issue there, that they're not able to get that B12 or folate into the cell. It's just sticking around in the serum and being excreted. So now you've got a lot of expensive urine if it's not able to get into the cells. And so that's something that we definitely want to look at. And the Vibrant Micronutrient Panel really helps us see both sides, inside and outside the cell. Then I see iron and vitamin K that are often decreased, and we'll talk about each of these briefly. So starting with omega fatty acids, they're very important for inflammation, which we see kids with autism often have a lot of inflammation in their bodies, in their brains, in their gut. There's a lot of inflammation going on, just an immune hyper response. Then we see that omega-3s are important for brain and heart health. We also see certain studies show a variety of improvements in children with autism, including social interactions, decreased repetitive and restrictive interest, decreased behaviors, lethargy. We can see that they improve their nonverbal intellectual ability, restlessness disappears, self-injurious behaviors decrease. There's a lot of really interesting studies that talk through omega fatty acids, particularly omega-3s, and their importance with autism. I would say 99% of the picky eaters that I work with do not eat any sort of omega-3 source. They're not eating fish. They're not eating any of the plant-based sources like chia or flax. And so they're basically getting no intake of omega-3s unless we're supplementing. So this is definitely something that we need to pay attention to and make sure that they are getting enough omega-3 fatty acids. Honestly, I think everybody in the US could benefit from additional omega fatty acid intake. Then we see a decrease in vitamin D, which is one of the most common nutrient deficiencies in the world. But for kids with autism, we see that they may additionally have low vitamin D amounts, and that could be related to another gene, which is called the VDR gene, which may be affecting the vitamin D receptors. And we see that that can be abnormal in kids with autism. But vitamin D is really important for our immune system, mood balance, reducing inflammation. And we see that vitamin D deficiency can increase autism traits and symptoms with autism. I don't like the way that that's worded, but using vitamin D supplementation may improve attention span, eye contact, and behavior. And so this is also a very important nutrient to consider with autism. B12, like I said, intracellular B12 is really what I'm looking for here when I look at these panels. Oftentimes those serum levels are very, very high and is very important for neurologic function and formation of DNA. And so we can see that individuals with autism may have these low levels of B12, which can be caused by the methylation issues or low stomach acid, which comes back to having that low digestion. B12 has to be activated in the stomach to be able to absorb it. And so when we have very low digestive function, we're not activating that B12, we can't absorb it very well later on in the gut. And so this is definitely something that we need to focus on, especially that methyl B12. We want to use methyl B12 over the cyano B12, cyanocobalamin, which we see in many of the artificial supplements or sometimes even in food fortification, because that methylated ingredient is the one that's going to be utilized by the methylation cycle a lot easier. Then we have folate, which is one of the most studied vitamins in relation to autism. I would say B12 is up there as well. The receptors for folate, like I said before, they may have autoantibodies on that or against them, so we can have some issues with absorbing folate. We see that the MTHFR gene mutation is really important here to make sure that we're metabolizing and using that folate well. And deficiency can cause weakness, fatigue, poor concentration, irritability, headache, GI issues, lots of different symptoms here that we can see overlap with some autism symptoms too. So it's just really important that we can get to the bottom. If they do have a folate deficiency, let's test it, let's treat it with supplements and diet, or if we need to use supplements first while we work on expanding diet, that's great. We can at least prioritize the foods that we want to use that are rich in folate. Then we have two more, iron and vitamin K. So iron, again, is one of the most common nutrient deficiencies in the world and can cause pica, which is eating non-food items. I've worked with kids who do not want to eat any foods, yet are chewing on rocks and marbles and sand, eating chalk. I had a kid who had eaten detergent before, and zinc and iron both can cause pica. So if you notice that you have a kid who's eating these non-food items, it's definitely worth testing iron, seeing what level they're at, and not just serum iron here. It's helpful to also measure ferritin, which is a longer-term marker in the liver, which can look at long-term iron status or stores. And that's helpful for me to see. I like kids' ferritin levels to be over 50. Oftentimes I see kids who are struggling with pica mica under 10, or zinc levels very, very depleted as well. So we don't want to just do a finger prick iron level. Most of the parents I work with are like, oh yeah, our iron, our child's iron has been tested, and they said they were on the low end, but it was just one of those finger prick tests. And that just doesn't give us the full information. Deficiency of iron can cause sleep issues, anorexia, fatigue. Sleep issues are a huge issue in autism, and that can be for many reasons, but I've worked with many people who started iron supplements and their sleep issues went away. It's quite amazing, actually. So looking into iron, if there are sleep issues, you want to make sure that you're not over supplementing, because we know iron can be fatal if used in too high of amounts. So, making sure that you're choosing the right amount and the right type, especially if the child has issues with constipation. We want to make sure that we're not starting at too high of a dose of iron that could cause them to be constipated as well. So there's a balance here. And then lastly is vitamin K, which we see is very important for brain development, and that vitamin K can even be a protective agent against oxidative stress from toxic exposure in kids with autism, which I think is amazing. Vitamin K can be low due to intake. We know it's in leafy greens, and a lot of picky eaters aren't eating tons of kale and spinach. So we want to make sure that if we are not consuming a lot, that we supplement and continue to work on expanding diet. But what's also helpful to know about vitamin K is that it is made in the gut. So if we have gut issues and the bacteria in the gut are not doing their job properly, or we don't have good stores of beneficial bacteria, vitamin K may not be, it's not being made very efficiently in the gut. So addressing underlying gut issues can also help with vitamin K levels later on. So the bottom line here is that nutrient deficiencies in autism are common, and they should be addressed by diet first and then supplementation. Diet quality affects nutrient intake, but absorption could also be a limiting factor. So for kids who even have a great diet and they're eating a lot of nutrients, or a lot of nutrient-dense foods, but then we look at their nutrient panel and they're deficient in many nutrients, then we can see, okay, maybe they're not absorbing these very well. It can also be helpful when you're looking at a panel to be able to recognize a pattern. If you notice a kid is having a great diet, but they're consistently low in vitamins A, D, E, and K, well, those are our fat-soluble vitamins, and maybe they're not breaking down fat very well. So a digestive enzyme might be helpful. But recognizing some of those trends that come along with working in this area for a while, consulting the Vibrant Clinical Care team can be really helpful as well. And working with many patients with autism, because they are so different, but sometimes we can see some of these common trends. Then using micronutrient testing to efficiently and effectively target these nutrient deficiencies. I will say parents who have kids with autism, they're doing a lot of things. They're working with occupational therapists and speech pathologists and ABA therapists, or developmental pediatricians and physical therapy. I mean, there's so much that they're doing that it can be really difficult to just guess on what nutrients that they're low in, and if it takes a long amount of time, and if kids are picky eaters, there's just a lot here. And so it can be really helpful to test for micronutrient deficiencies so that we can just kind of get in there and start doing the work to replete those nutrients that they're having issues with. MTHFR testing can also help us identify causes for methylation issues and indicate further treatment. So let's say that we did a micronutrient test and we saw that folate and B12 and B6 were low. That could give us a good idea, hey, is the methylation cycle off? And doing that MTHFR test can help us figure out the root cause and some other things that we might need to do to help them have the best outcome. And then lastly, interpretation and the ability to recognize these patterns, like I said, in these nutrient panels is vital. Consult the Vibrant Clinical team. They're amazing. And when first starting out with Vibrant, truly made a world of a difference to be able to consult with them and talk through some of the things that maybe I missed, or some of the implications for autism that we should definitely dig a little bit deeper, and may even indicate additional testing, like doing an environmental toxins panel or testing for mold or whatever it may be, just digging deeper and looking to get to the root cause of these additional issues. always test, don't guess. Again, I love the micronutrient panel. I use it all the time with my clients, as well as the environmental toxin panel and so many others. So I definitely recommend, if you haven't used this with your clients, I think it's an incredible tool. I would love to connect with many of you. Again, my Instagram is Autism Dietitian, and that's where I am nearly every day. So would love to connect with you there. Though you can also connect with me on my website, autismdietitian.com, and the Autism Nutrition Library, which is a resource that I have, like I said, for parents and providers to help take some of the guesswork out of nourishing autism. There's a lot of information, as you can see in this webinar. This webinar could be days long because there's so much information about every nutrient in autism in the gut, toxic load, different supplements. And so this is really a place where we break down what the research has to say, make it easier for parents and providers to really address these underlying issues and get to the root and help kids feel their best, do their best, and be their best. So if you're interested, definitely check it out at autismnutritionlibrary.com. You can also find this link on my Instagram too. So thank you so much, everybody, for being here. I would love to answer your questions. It looks like we still have about 8 or 9 minutes left. So hopefully this is good timing to answer some of the questions that have been submitted and continue finishing out this presentation.
Thanks, Brittyn. That was awesome. I just want to say, first of all, I love how you are so familiar with all of our education portal resources. I can't tell you how many practitioners I correspond with on a daily basis. And like, it seems like some of them are still unaware that we have this whole internal portal they can log into that has resources and education and webinars and videos. So yeah, that's amazing. And thank you for sharing some of those resources and highlighting some of the ones that you found really valuable. I also think you gave some super actionable tips here for ways to, what are the next steps after you've identified the micronutrient deficiencies on lab testing? How do you figure out where they're coming from? And I think that was kind of the biggest question that you answered today was, okay, we know that these deficiencies are here now that we have this objective data from the patient. What do we do? How do we figure out why they're deficient? And so that was super helpful.
Thank you.
There's a few questions. So let me just, let's see, Courtney asked, from a business standpoint, if there are many different tests that could be beneficial with these patients, how are you offering your services? Do you have a few packages where you group together all of these tests and your sessions? Or do you email a quote for your test prices to your patient? Sorry, this is a long question. It has several questions in it. Do you email a quote for test prices to your patient and then have them look them over and see what they want to start with? She says, I often start with food sensitivity testing, but have recently started using the gut zoomer and nutrient panels too. I'm just trying to decide best way to present costs, options, services, minimize overwhelm for the patient, but offer everything I can to help them.
Yeah. Oh, I feel this so much, especially when I first started out with, using testing, trying to find the best way to support parents, but also reducing some of that overwhelm because it can be a lot to test. So when I first started out, I would really do it based on the individual symptoms when I first saw them and start with, okay, let's start with a GI panel, which I think is still a great place to start. Like if you wanted to start with a gut zoomer, you can see what's going on in the gut because it's so important for autism and it could indicate future testing, like doing a micronutrient panel or doing a food sensitivity panel. So if I'm ever in doubt, I definitely think GI testing is the way to start. But it can really depend on the individual. What I do now, I have a 6-month program that I work with clients through that includes 5 different tests that I offer for my clients. That includes MTHFR, micronutrient, environmental toxins, GI, food sensitivity testing. And I do that all with all of my clients. And so it really gives me a good idea of where we're starting and what we need to focus on throughout the duration of our program. So that's been after years and years of working in this field and creating that kind of package or program for clients to work through. And I have a lot of success because it's something, it looks at everything. And that's what my clients want to do, is do all of this testing. So I think that the people who come to me have also found me on Instagram and are wanting to do testing. So they're maybe a little bit more open to starting off with all of those tests. But I think when in doubt, start with GI, in my opinion.
Great. And I think, in my experience as a provider, it helps to be able to describe what exactly you're testing for and why that's important. What is the value that it's going to provide to the patient? So whether it's a gut test or a micronutrient test or some bundle, explaining the way that those tests fit together as far as this is going to tell me what's happening in your gut. This is going to tell me how that's translating to your body. This is going to tell me if you have increased toxic burden. And all of that together helps me treat you individually versus, throwing darts in the dark and hoping one of them sticks.
Yes, absolutely. I agree with you. And I think, I mean, the parents that I work with, by the way, are absolutely incredible. The parents that have kids with autism, they are researching and looking for answers and just doing the work that a lot of times I have people come to me and are like, oh, I already know why we're doing that because I've researched it. But for those who maybe are new to this and they haven't, they don't really know much about nutrition, it is so helpful to tell them why and some of the reasons why we might consider doing all of these other tests. And then if you start with GI, from there, they can also see themselves on a piece of paper, see their child on a piece of paper where they're like, okay, this indicates that we have this issue, this issue, this issue. This is why we should do this additional testing. So, but that's a really good question though. It's, I would say per person, it can be difficult depending on their resources and ability to test as well.
Yeah, absolutely. That's a good point. One other question from Kelsey is, how do you go about getting autistic kiddos to do the blood draws?
Yeah, that's a good question. It can be really difficult. And I think a lot of parents are the most worried about the blood draw. So there are a few different approaches that we can do. Number one, if we're going to do a whole blood draw, I always will suggest that they have a mobile phlebotomist come to their home. And Vibrant has a really great directory where you can look up some blood draw or some mobile phlebotomist or a blood draw center nearby. For my clients who are local, I have connections where I'll recommend that they connect with a certain mobile phlebotomist that works with kids with autism or has worked with kids in the past. And so that can be great. You can use a little numbing cream and help make that area numb for them. But having them in the home in their regular environment, watching a TV show, you can put up a little poster board where they can't see their arm and it getting drawn. Providing positive reinforcement can also be really helpful if they have a positive reinforcement system already. If a blood draw is not going to work, there is a finger prick test. And so that has been really helpful for my clients who just absolutely cannot get a blood draw done. A finger prick test, I haven't had any issues with clients getting that one done. I'm sure it's not fun sometimes with little kids who maybe don't understand what's going on, but I have used that really successfully and is a great backup for whole blood. In my opinion, I want to get the whole blood first and then go for the finger prick if we can't get whole blood.
Awesome. And that finger prick is a Vibrant test. Vibrant has two micronutrient tests. The one that Brittyn's referring to, that's the blood draw, that's our micronutrient 3.0. Under the Vibrant Wellness menu, there is that whole blood nutrient profile, which is a finger prick test. It does not separate intra and extracellular values. However, it is a pooled result. So it's both of them combined. And it is very easy to collect. I will definitely say that. Let's see. Looks like Carol had a question.
I saw that, but I don't feel that that is in my realm to answer.
Oh, gotcha. Yeah, Carol, that might be a better question to follow up with perhaps someone who uses that or who can prescribe it. That would be a little outside the scope of practice for this. Okay.
Yeah, so Christina just said something about ADHD and micronutrients. I definitely recommend micronutrient testing with ADHD as well. I find that they often have a similar profile to kids with autism, though, I mean, most of the kids I work with do have autism, but some don't and just have ADHD. But that is definitely something to consider because, I mean, a lot of the nutrients we just talked through, they have to do with cognition and focus. I mean, ADHD falls right in there. So I agree that gut testing, first of all, and then micronutrient testing can be really helpful for ADHD.
Great. Well, Brittany, it looks like we're at the end of the hour here, and this was super informative. I think everything you covered was amazing and a really great starting point for anyone working with kids with autism or individuals on the autism spectrum. You walked us through the basics, what it is, what it isn't, the things to look for, and then as far as diving into how do we figure out where it's coming from as far as nutrient deficiencies that could be contributing to the whole cascade of things. So I'm really, really excited that we have this resource. And for those of you listening, this will be available in our portal. It generally takes a couple of days for us to get the recordings up. We'll make some slides available downloaded as a PDF if you want to print those and take notes if you want to rewatch this. Brittyn, can you throw out I know you already threw that out to begin with, but your social media or ways for people to connect with you with your resources? Perfect. There we go.
Absolutely. I would love to connect on Instagram. I do have Facebook and Twitter. I will say I'm not on those as much. Instagram is my place. And then my website is autismdietitian.com, and then the autismnutritionlibrary.com as well, which you can see a little bit more here. And would love to connect either place. And the Autism Nutrition Library, by the way, has a forum. So if there are additional questions, feel free to post in the forum under questions.
Great. Well, I want to thank you so much for your time today, Brittyn. It's been wonderful having you. Thanks for everybody who tuned in. And let's wrap it up and jump back into our day.